Welcome guys, this is Dr. Balagoni Hanuman, M.V.Sc scholar at Veterinary Surgery and Radiology. So today we are going to discuss about glaucoma in dogs. So the contents of this presentation includes the introduction and anatomy and functional outflow of this aqueous humor and the classification of glaucoma and the medicinal treatment as well as surgical treatment. So coming to the introduction, so as a standard definition, we can say that the glaucoma is a heterogeneous group of progressive disorders. So it indicates it's not due to a single factor. Various progressive disorders they are leads to the glaucoma. So which are characterized by retinal ganglionic cell death and the cupping of the optic disc. So this cupping of the optic disc is a characteristic lesion in case of glaucoma. So in clinics, if you take it is one of the leading cause of loss of vision. So why it is a worrying matter? So because glaucoma, most of the cases they present in advanced cases because the owner may not be attentive in case of the pets. Sometimes the dogs can see even if the loss of vision is there in single eye, and the pets also even if they are having the pain in one eye, the their inability to communicate to the owner. This is also one of the reason for this presentation in the advanced stages. So, in case of primary open angle glaucoma, we can see the changes in the retina and we can treat accordingly. So, coming to the anatomy of the eye, so you can see here the lens and the anterior chamber, and this is the cornea, and this is the posterior chamber. This is the vitreous, and this is optic nerve. So, if you say anatomically, there are fibrous tunics, vascular tunics, and nervous tunic. Fibrous tunics include this cornea and sclera, and vascular tunic includes iris and ciliary body. This nervous tunic includes optic nerve. So before going to the learn about the glaucoma mechanism of action of different drugs, we need to know the anatomy of the this anterior chamber and posterior chamber. So let us say this is a eye we are seeing from the front. So if I tilt it to the 90 degrees and if I cut to the half of this one, so we can see this. So this portion is of lens. It is of lens. It is the lens, and this is the ciliary body muscles. So this ciliary body having the processes which can attach to the lens. So this portion is the posterior chamber where the aqueous humor is secreted from the ciliary body to the posterior chamber. So from here, the aqueous humor flows to the anterior chamber through this pupil. This is the pupil. So this is the iris. So from this, the aqueous humor flows out of the eye through this trabecular meshwork, which we will be studying in coming slides. So see this, you can see the direction of flow of aqueous humor. So this is the direction I already mentioned. So coming to the trabecular meshwork. So this is the flow direction of the aqueous humor flow from the posterior chamber to the anterior chamber, then to the trabecular meshwork. So if you see the trabecular meshwork, so this is nothing but the connective tissue fibers which are arranged in the iridocorneal angle. So they are having the gaps between them. From that gap, the aqueous humor will be flowing out of the anterior chamber. So coming to the aqueous humor production, if you see the main place of production of aqueous humor is the non-pigmented cells in the ciliary body. So the production takes place with the passive and active processes. So passive process includes the diffusion and ultrafiltration. So the ultrafiltration includes the allowing of the molecules to cross cell membranes following hydrostatic pressure or osmotic gradient. So these mechanisms generates a reservoir fluid within the ciliary body. So this reservoir fluid ultimately it will be going into the posterior chamber based upon the concentration gradient. So that concentration gradient is brought up by this active secretion of the ions. So the active secretion of the sodium as well as chloride and bicarbonate ions into the posterior chamber, this will make the increased osmolarity in the posterior chamber so that it will drag the fluids from the ciliary body. So this reservoir fluid will be dragged into the posterior chamber. So this active process constitutes around most of the majority, and it means 80 to 90% of aqueous production. So until unless you understand the mechanism of this aqueous production and secretion, you will not be understanding the mechanism of action of the different drugs. So for the active secretion, as I have already mentioned, that 80 to 90% of the aqueous production is by active process. So if you want to decrease the production, you have to decrease the processes involved in this active secretion. So coming to the active secretion, it requires hydrolysis of ATP. So this hydrolysis of ATP, it is done with the two enzymes. One is ATPase sodium potassium pump, which constitutes 70% of aqueous production, and carbonic anhydrase 30 to 40% of aqueous humor. So these two enzymes are responsible for the production of energy as well as the active secretion of different ions. So if you want to decrease the aqueous humor production, you need to inhibit these two enzymes. So the drugs which are pointed towards the inhibition of these two enzymes will leads to the decrease in the aqueous humor production, and we will come to know. I will explain in detail different drugs. So these enzymes, these main two enzymes are concentrated towards the non-pigmented ciliary epithelium. So as I already mentioned that the non-pigmented ciliary epithelium of the ciliary body is the structural site for the active secretion of aqueous humor. So the sodium ions first they are secreted, followed by secondary active secretion of chloride ions, and then the bicarbonate ions are secreted into posterior chamber, which will make the high osmolarity. So we can see all those mechanisms here: sodium as well as chloride ions, as well as and bicarbonate ions. They are coming to here. This is the posterior chamber. So these two cells are non-pigmented epithelial cells. These cells are pigmented epithelial cells. So all these ions are released into the posterior chamber, and the concentration gradient is increased over here. So this will drag the fluids from the ultrafiltration into the posterior chamber. So this is the mechanism of releasing of the aqueous humor into the posterior chamber. So if you see the amount of aqueous production, you cannot measure how much aqueous is producing, but we can measure indirectly by the calculating the how much aqueous is going out. So these are the standard values in the humans as well as dogs of aqueous humor production per daily to daily basis. Now coming to the functional anatomy of aqueous humor outflow. So this aqueous humor function includes the nutrition for the different structures in the eye. So if you want to decrease the aqueous humor production, you should not decrease by up to 0%. So because it is a major source of nutrients for different structures in the eye. So the drugs which are having the function to decrease aqueous humor production, they will reduce maximum of 18 to 35 like that percentage. So coming to the functional anatomy, so the aqueous humor whatever produced in the eye, it will either go out of the eye by the conventional outflow pathway. We can say this as anterior trabecular outflow because the all trabecular meshwork is included in this. This is the major one. Basically, this is regulated by IOP. It means if the IOP is more, then a conventional outflow is also more. If IOP is less, this will be less. So unconventional pathway, if we can call it as Uveoscleral outflow also, it is independent of IOP. It doesn't care about what is the IOP in the eye. It is only regulated with the osmotic gradient in the eye. So this is the trabecular meshwork I have already shared. So this is the microscopic view. So one cannot understand what is this, what is the mechanism behind this outflow. So there are various structures involved in this trabecular pathway. Once just if you know how it is flowing out of the eye, then you will be understanding the further slides. So this is very simple. You can see the eye is looking this side. Just let us say eye is looking this side. So I'm talking about this slide. So this is the iris, this is the posterior chamber. These are all our ciliary processes, and these pectinate ligaments. Pectinate ligaments are these are connective tissue strands which are coming from the iris, and they will be directed towards the iridocorneal angle. So this is iris, and this is cornea. So this is the iridocorneal angle. So this is I also we can say this is an anterior chamber also. So now coming to the trabecular meshwork, here it is uveal trabecular meshwork. This is uveoscleral because as we know that iris and ciliary body together is known as uvea. So this area is uveal trabecular meshwork, and here the uvea is going into the sclera. So it is called as uveoscleral trabecular meshwork. Here if you see this is nearer to the cornea, corneoscleral trabecular meshwork. So those things, these structures we can see here also from this trabecular meshwork. There's spaces of Fantana, which are the spaces between the strands of the trabeculae. So these are uveal trabecular meshwork, and these are uveoscleral trabecular meshwork, followed by corneoscleral, and followed by juxtacanaliclar trabecular meshwork. So from here, the aqueous flumer is going into the cells as a granules. So this aqueous humor is going into the cells as a granules, and these granules are released into this angular aqueous plexus. So these angular aqueous plexus are channels specially for aqueous humor. So from here it will go to radiating column channels. From here it will be going into the intracellular venous plexus. So this is the microscopic anatomy for the outflow. So the outflow of the aqueous humor can be done with the three pathways. So either it is go to the anteriorly into the epicellular and conjunctival veins, like here epicellular and conjunctival veins. Otherwise it can be go out of the eye through the posteriorly into the scleral venous plexus and vertex venous plexus. Otherwise it will go to the uveoscleral pathway like this in suprachoroidal space, from there into the globe. So coming to the uveoscleral pathway, this is, as I mentioned, this is a minor pathway. There are some other drugs, some drugs which can increase this pathway. Examples such as synthetic prostaglandins. So why this uveoscleral pathway is important in case of dogs? So as we know, and I will be going to explain in the types of glaucoma. So there are two types of glaucoma: primary open angle as well as primary angle closure. In dogs, if you see, primary open angle is very less common, whereas primary angle closure glaucoma is majority of the cases you will see this. So as the angle is already closed, there are no need of drugs which can increase the outflow through the trabecular meshwork. But in angle closure, primary angle closure glaucoma, this uveoscleral pathway will be useful. So coming to the causes of variation in the intraocular pressure. So in case of dogs and humans, in morning the IOP will be increased, and in night the IOP will be decreased. That is that is reverse in case of cats, rabbits, and non-human primates. So coming to the age, as ages increases, the production and outflow they both will declines. But as age goes on, the production will be decreased first, then outflow will be decreased. In some animals, the outflow decreases first and the production decreases next. So in case of cats, after 7 years of age, there will be decreasing in IOP by 1 mm per year. So if you see these two pictures, if for example say these two dogs are genetically predisposed for glaucoma, for example. So in case of these two dogs, this dog will be having more chance of getting glaucoma. So the reason being, if you see here, it is a body belt and it is a neck collar. So this neck collar it will press the jugular vein. So this jugular vein, because of the pressing here, there will be accumulation of blood over here. There will be a reduction in the outflow of the aqueous humor. So it will leads to the increase in the glaucoma occurrence. So just like the tranquilizers, which can decrease the intraocular pressure, and ketamine and diazepam, they can transiently increase the intraocular pressure.